Hi, my name is Marcia Santiago and I'm a lactation consultant with the Community Health Center of Richmond. In this video, I'd like to discuss how to increase a low breast milk supply. First, it's important to note that what many women perceive as a low breast milk supply is actually a misunderstanding of their baby's behavior. Some women misinterpret their baby's natural desire to continue to suckle at the breast as the baby not getting enough breast milk. Please see our other video on how to determine if baby is getting enough. Breast milk supply is driven by two main factors. One is hormonal, and the other is driven by supply and demand. Either of these can be increased at any time. So while many women fear that they've lost their milk supply, it's reassuring to know that they can increase their milk supply at any time. Oxytocin, also known as the love hormone, is responsible for the milk ejection reflex, which helps your breast milk to flow. Getting baby down to a diaper and placing them on your bare chest is known as skin to skin. Skin to skin increases your oxytocin levels. Increasing your skin to skin time can help increase your breast milk supply by making breast milk removal easier. The next hormone we'll talk about is called prolactin. Prolactin can be thought of as pro-milk because it's one of the important hormones in milk production. Prolactin levels rise as baby suckles at the breast. Increasing the number of times that baby goes to the breast can increase your milk supply by increasing your prolactin levels. However, artificial nipples like baby bottles and pacifiers can reduce the number of times that baby seeks the breast. Getting rid of pacifiers and baby bottles can help baby seek the breast more often, therefore increasing your milk supply. Next, we'll discuss supply and demand. Supply and demand describes the way that the body responds to your baby's need for breast milk. Every time the breasts are emptied, the body responds by making more milk. The more often the breasts are emptied, the more milk you will produce. This is called fill factor. When breasts are full or aren't emptied frequently enough, the body responds by decreasing your milk supply. Increasing the number of times you remove milk from the breast will help increase your milk supply. One way to do this is by adding extra pumping sessions after a feeding. You should use a double electric breast pump and use it after each feeding. Using the breast pump after each feeding will tell your body that the baby has a higher demand, therefore increasing your milk supply. If you try this for about 2 weeks, you should see a significant increase in your breast milk supply. Remember, don't get discouraged. Remain calm and try to do things to reduce your stress level, which can also negatively impact your milk supply. Skin to skin can increase your oxytocin levels and other feel-good hormones, which can reduce stress. Some women get discouraged and often ask me about other ways to increase their milk supply, like adding foods or herbal supplements. While some foods like oatmeal may be healthy, some herbs may be contraindicated with medications you're taking or your medical condition. Be sure to speak to a healthcare provider and a lactation consultant before considering adding herbs to your diet. Remember, you can always reach one of our lactation counselors who are ready to help you troubleshoot any breastfeeding concern.